sometimes you wonder what kind of a community that we're living in. It's like, okay, you don't have the money to pay for the medical care you need? How's this? Find somebody who'll do it for free. That's the big solution that we're giving to people in some of these instances. I just don't think that that's the right way to treat people. And I think sometimes we get caught up in the details of, this funding level or that funding level, but I think sometimes we need to take a step back and think about that these are real people. These aren't just numbers on a sheet of paper. And I heard a story about a woman who had been on the waiting list for Medicaid for dental coverage. And the waiting list to get dentures, if you're a senior citizen who needs to get their dentures through Medicaid, the waiting list is 2 years long. And, you feel like you're not even living in a developed country at that point, that, we need to provide a basic level of services for our most vulnerable here in Virginia, and we're failing right now. I think when we talk about what kind of solutions that we're going to get into, yes, you can talk about, cost savings, and I think hopefully we'll have some leadership on the national level now that President Obama is talking about doing things like universal health care, and maybe eventually, I know outside this room this gets a little dicey, but towards a single payer system where, you don't have to fight the insurance company that, the government is providing the care that people need. But I think it all does come back to funding, that what are you going to do to increase the levels of funding here in Virginia? And I think, we had the discussion, it keeps coming back to taxes tonight. I think it just came back to it again. And I think you have to be willing to stand up in the General Assembly